Thank you for listening to Depictions Media Radio. Welcome to Policy and Rights, the show about human rights and government policy. Try again. And welcome back, everybody. It is April 9th, and we're getting updates from Justin Trudeau, Prime Minister of Canada, and John Horgan, Premier of British Columbia, and the Minister of Health and the official health officer of British Columbia, Adrian Dix, and Dr. Bonnie Henry. And there have been some statistics that have been outlined, or predictions that have been outlined according to modeling, and we need to understand that that modeling is there so that our health officials can plan so that they can keep that curve down. It is not a true prediction. It is something that appears in the numbers that we don't really need to pay that close attention to. What we should be paying attention to is the fact that over 1 million of us are out of work, and that there are some people who are out of income that fall through the cracks of the programs that are put in place. And we'll hear John Horgan talk about some of that, how the provinces are going to try to adjust programs so that they can close those gaps up, so everybody gets some sort of help and no one is left behind. The other thing we need to focus on is the personal protective equipment, that we need to ensure that this equipment gets to the right people, that they're not all face masks are created equally, not all gloves are created equally, and that we need to ensure that the frontline healthcare workers actually get the ones that match the specs that are going to give the most protection. They get that equipment, because without them there is no other protection for the rest of us. Who's going to care for us, that sort of thing, right? So let's go get on with Justin Trudeau, and here we go.
Bonjour tout le monde. I want to start off today by talking about the job report we just received for March. As stark as those numbers are, they aren't a surprise to a lot of Canadians. Each one represents a different story. A worker who's been laid off, a family that's having to hunker down, a community that's anxious about today and tomorrow. We've all seen the impact of COVID-19. We all knew this was going to be a tough time, and that countries around the world are in a similar situation. But that's no comfort if you're out of a job, if you're having difficulty making ends meet. You need real support. So we're doing our best to help you bridge to better times. On Monday, we launched the Canada Emergency Response Benefit. More than 4.5 million claims have been processed, which means people are already receiving their $2,000 for this month. We're also working on legislation to bring in a wage subsidy to help employers keep people on the payroll while working on new loans for business owners. We will keep expanding our 3-point economic plan to protect jobs, business owners, and get everyone the help they need. Things will get better, and once they do, you can be sure that our country will come roaring back. As a country, we've gotten through tough times before. We've stood together, united and strong. On Vimy Ridge, more than 100 years ago today, thousands of Canadians gave their lives so that our country would know peace. Aujourd'hui, nous nous souvenons de ceux qui sont tombés à Vimy il y a plus de 100 ans aujourd'hui. On se souvient des sacrifices qu'ils ont faits pour notre pays. Ils se sont battus pour défendre les valeurs qui sont chères, comme la démocratie, la liberté, l'égalité, pour les valeurs qui définissent encore notre pays. As historians have noted, reflecting on Vimy, it was a moment ordinary people did extraordinary things. Fathers and sons, brothers and friends, their sacrifice and courage defined what it is and what it meant to be a Canadian. And their legacy lives on in the women and men who continue to step up and serve us in uniform, in our nurses and doctors who put themselves in harm's way for us all to stay healthy, and in everyone who steps up and asks what they can do for their fellow Canadians. That's what makes Canada strong, and that will be our path forward, no matter what tomorrow may bring. Right now, the future can seem even more uncertain than normal. If you've lost your job, if you're worried about an elderly parent, you probably want to know what to expect. Earlier today, we released our modeling on how we think this pandemic might unfold. The modeling shows that COVID-19 arrived in Canada later than in other countries. So we're in an earlier stage of the outbreak. That means we have the chance to determine what our country looks like in the weeks and months to come. Our healthcare systems across the country are coping for the time being. But we're at a fork in the road between the best and the worst possible outcomes. The best possible outcome is no easy path for any of us. The initial peak, the top of the curve, may be in late spring with the end of the first wave in the summer. As Dr. Tam explained, there will likely be smaller outbreaks for a number of months after that. This will be the new normal until a vaccine is developed. But as we saw, that is so much better than we could face, all of us, if we do not rise to the challenge of this generation. The path we take is up to us. It depends on what each of us does right now. It will take months of continued, determined effort. We'll need to keep practicing physical distancing, staying home, and washing our hands. It will help. It will help get the numbers that Dr. Tam was talking about, between 4,000 and 44,000 deaths, as low as possible. Je sais que la Dr. Tam et toute l'équipe de l'Agence de la santé publique ont travaillé très fort pour préparer ces prévisions. Et pour nous assurer que toutes les informations sont à jour, nous avons été en communication constante avec les provinces et les territoires pour obtenir leurs dernières données. Plus tôt aujourd'hui, nous avons dévoilé nos projections. Les modèles démontrent que la COVID-19 est arrivée au Canada plus tard que dans d'autres pays, donc on est à un stade plus précoce de l'épidémie. Ça veut dire que nos gestes ont encore plus d'importance pour décider à quoi notre pays va ressembler dans les semaines et dans les mois à venir. Pour l'instant, nos systèmes de santé tiennent le coup, mais on est à la croisée des chemins. La route qui va nous mener aux meilleurs résultats ne sera pas facile. On pourrait atteindre le sommet de la courbe à la fin du printemps et la première vague pourrait se terminer pendant l'été. Mais comme la Dr. Tam l'a expliqué, on va probablement connaître d'autres vagues d'infection moins importantes pendant un certain nombre de mois. C'est et ce sera notre nouvelle réalité jusqu'à ce qu'on trouve un vaccin. Mais comme on l'a vu ce matin, c'est le meilleur scénario qui pourrait se produire. Si on l'a vu ce matin, c'est un meilleur scénario que ce qui pourrait se produire si on refusait d'agir. La route qu'on va prendre dépend entièrement de nous tous. Il va falloir être discipliné pendant les prochains mois. On va devoir continuer à rester chez nous et continuer à nous laver les mains. C'est comme ça qu'on va éviter des milliers de décès et qu'on va réduire de cas. I know it's tough to stay home, especially as the weather gets nicer. If you have kids, it's even tougher. But to get them back outside and running around the playground and park as soon as possible, you need to keep them inside for a little longer. This will work, and we'll be with you every step of the way. Just this week, we received millions more masks to keep our frontline workers safe, and we have contracts to get more ventilators. We're helping industry mobilize, like the entrepreneur from Vars, Ontario, who's creating reusable visors for hospitals across the province. And we've continued to support Canadian researchers working on a vaccine. We're pulling out all the stops to virus and help you get through this time. On doit tous faire notre part, les gouvernements, les entreprises et les citoyens. Donc, continuez de rester chez vous. Allez faire votre épicerie une fois par semaine et seulement, une fois par semaine seulement, ou encore moins souvent. Et si vous devez sortir, gardez 2 mètres de distance entre vous et les autres. C'est comme ça qu'on va protéger les personnes vulnérables. C'est comme ça qu'on va protéger nos aînés. C'est comme ça qu'on va sauver des vies. Et c'est comme ça qu'on va aider nos infirmières et nos médecins qui font un travail extraordinaire à chaque jour. Je sais que c'est pas facile, mais c'est pas pour toujours. Éventuellement, on va pouvoir retourner au cinéma, au restaurant et au parc. Mais pour ça, tout le monde doit faire sa part maintenant et pour les semaines à venir. Over 100 years ago today, Canadians showed what metal we are made of. I know each of us will rise to be worthy of the legacy of the heroes that built this country. We can do this together. Merci tout le monde.
Okay, so Justin Trudeau is trying to inspire us by also comparing Vimy Ridge to COVID-19 and saying that if we had the right stuff, then we have it now, and that we're going to all get through this. He's trying to unite us through something like Vimy Ridge. I think it's a good job on his part. We're going to hear from John Horgan now. And John Horgan and Julie Darcy, they're going to be talking about mental health, and they're trying to close the gap so that everybody gets the help that they need, and that's what needs to actually happen here. We need to actually look out for each other and take care of each other, do what we can to help all of us get through this time as a community, and that's what John Horgan and Judy Darcy are really trying to get at with this. So let's listen to what they have to say.
Thank you, Jen, and good morning, everyone. It's good to see you again today on another sunny morning in British Columbia, southern British Columbia. I want to talk a little bit today about the challenges that people are facing with mental health. These are unprecedented times. People's lives have been turned upside down. If you're a frontline worker, you're working hard, you're stressed, your family is stressed, you're under intense pressure. People have lost their jobs, businesses have been shuttered. Seniors are safe at home, but they've lost their connection to the outside world in many cases. And those who do live alone or live in remote communities are feeling more isolated than ever before. And whether you're feeling stuck at home or separated from other people, this pandemic has been difficult for all of us. Everyone is experiencing stress, anxiety, depression, and disconnection from what the world was supposed to be. And so as we look at the many, many challenges, we talked about programs for financial assistance. We've talked about programs to ensure that people are staying in place, to ensure that our borders are safe, to ensure we're doing everything we can to help people financially. We also need to step up and make sure that the COVID-19 pandemic is not going to adversely affect our mental wellness, whether it be through anxiety, depression, or other stresses in what are now becoming our daily lives. And, of course, growing up, young people particularly are hard hit by this. We all remember being young, whether we were in high school or college or even in our early adulthood. Connecting with other people is part and parcel of what we do. We are social beings. This has been extremely challenging. And so what I've asked Minister Judy Darcy to do is to look at the range of programs that are available to people today and how can we supplement those by making sure that we can go virtual on some of these initiatives so that we can't necessarily go and visit people face to face. We can't meet people in large groups, but we can certainly meet with people through technologies that have been proven very, very effective, not just for frontline workers, not just for continuing our interactions in the work world, but also with school, also with social connections. So I'm very pleased to announce today that we put another $5 million toward virtual mental health services. Judy will go into the details on those, but these are critically important times for all of us, and we need to hang together. We need to recognize that although we may feel stress, we may feel bouts of depression at the challenges that we face as individuals, as a family, and as a community, together we can get through this. And the acknowledgement that mental health is something that we need to address has never been more present as it has been over the past number of years. When we appointed Judy Darcy the first Minister of Mental Health in Canada, it was with a view to protect people who were feeling vulnerable. At this difficult time, Judy's work and the work of healthcare providers, particularly mental health workers, social workers, has never been so important. So with that, I'll ask Judy to go into the programs that we're going to be announcing today.
Thank you, Premier. Now over to you, Minister Darcy.
Thank you so much, Premier. I'd like to begin by acknowledging that we're on the traditional territory of the Musqueam, Tsleil-Waututh, and Squamish Nations, the Coast Salish peoples. Good morning, everyone. And let me begin by acknowledging, as the Premier did, the incredible stress and anxiety that I know that so many people across British Columbia are dealing with at these really unprecedented times. The isolation, the loneliness, the financial stress of losing a job or losing a business, homeschooling with your kids, the fear of becoming sick with COVID-19. These are taking a tremendous toll on all of us. And we're seeing increased anxiety, increased depression, grief, loss, loneliness, and overall stress for people from all walks of life in all corners of the province. And many of the traditional ways that we're so used to living, many of the things that bring us joy have been put on hold. Whether that's celebrating birthdays or anniversaries with people we love, whether it's getting married, whether it's playing team sports or doing group exercise classes, going out to a restaurant or visiting with family and friends. And some of the most difficult things that any of us ever have to do in our lives have become heartbreakingly impossible, like not being able to comfort someone who's seriously ill and not being able to hold the hand of someone who's dying. And while we know that these physically distancing measures are temporary and are in everyone's interest, it's important to recognize both the immediate and the long-term impacts that this pandemic can have on people's mental health and well-being. Frontline service providers and community agencies are giving everything they possibly can. They're pouring their hearts and their souls into meeting the growing and the changing mental health needs in our communities, but they cannot keep pace with the increasing demands for help, and that's why we're here today. We know that staying connected while staying apart is more important now than ever before. So we're working with our Indigenous partners and with the Canadian Mental Health Association BC, with Foundry Youth Centres and others to make sure that people can stay connected to mental health care while doing their part to slow the spread of COVID-19. And just like the physical distancing actions we're taking to flatten the curve in the coming weeks, the actions we take now to look after our mental health and the well-being of our communities will reap benefits down the road. So today, we're announcing the expansion of virtual mental health supports across British Columbia. We're expanding virtual community counseling programs so you can talk to a trained professional in your community from home in rural and urban British Columbia. We're launching a Foundry Youth virtual clinic so young people and their families can connect to integrated, clinically supervised mental health, substance use, and primary care services. We're increasing access to Bounce Back, which is a free evidence-based telephone and online skills building program for people with mild to moderate anxiety or depression. And now, very importantly, anyone can access Bounce Back without a referral from a doctor. This is huge, and this will help so many people in our province. We're increasing access to virtual care for First Nations, Métis, and urban Indigenous people, and we're bolstering online peer support programs and virtual care for immigrants and refugees. And very importantly, we're creating a new online hub and virtual peer support network for frontline community healthcare workers. We need to make sure that we take care of the healthcare heroes who are risking their lives to keep us safe. And we're partnering with organizations like the BC Psychological Association, who have stepped up to announce that, and these are the last figures as of yesterday, 200 psychologists across British Columbia have volunteered their services to support frontline healthcare workers. Now more than ever, we have to take care of ourselves, and we have to take care of each other. And I cannot tell you how inspired I have been to see people stepping up all across the province in so many different ways to support each other. And I want to appeal to each and every British Columbian today, reach out to your friends and family. Check in on your neighbor or your elderly relative. Something as simple as a phone call or a text or a note can have a hugely positive impact. And whatever you're feeling right now, please remember that you're not alone, and please remember that physical distancing does not have to mean social isolation. Social connection is more important than ever before. And please know that professional resources are available if you need them now or down the road. We will get through this together.
John Horgan is asked directly about programs and closing gaps, so we're going to listen to how he responds to that question.
Vinder Sajan.
Hi there. This is a little bit off topic, but relates to the stress that a lot of people are feeling right now. The federal government has admitted that some people have been missed with the benefit programs that it has put out. And I know that previously, Premier, you said that the goal here in BC is to fill those gaps. Is the province looking at helping people who maybe don't qualify for EI and so don't qualify for the $1,000 benefit from BC, who don't qualify for CERD, and a small business may not actually qualify for some of the loan relief programs? Is that one of the gaps that you're looking to address?
Yes. I'm supposed to wait 2 seconds.
Wait 2 seconds, sorry.
Yes, thank you for the question. And these are just the sorts of things that we were waiting to find out. There's a comprehensive series of programs that have been put in place by the federal government. We have said clearly from the beginning, we put aside over $5 billion to fill gaps, and now we're seeing those gaps emerge. We have put our task in front of us to make sure that as people go through the federal process, don't find a place for themselves, that they can come to the province and seek redress of some kind. But for the vast majority of people who have qualified through the CERB programs, that opens up opportunities. For example, today our rental supplement program will go live. People will have verification that they've been approved at the federal level. We can get them dollars starting today. Our BC Hydro programs have already been up and running so that people can get the holiday or the deferral that they're looking for on their hydro bills, so that we can see liquidity for small businesses, and of course not having to see outlays of cash from people who've just lost their jobs. But the whole point of saying to the public, the whole point of working with the federal government was when the programs go live, as they did this week in Ottawa, that's when we see clearly what people can fit into and what they can't, and we'll build from there. And we won't be doing that alone. The federal government has been fairly clear as well that when they see gaps, they're going to take steps to help fill them. So I'm confident that we are now in a place, 5 weeks for BC, 3 to 4.5 weeks for other jurisdictions. We're getting the hang of this. We're creating these programs on the run, and we're doing our level best to make sure that people are well during this difficult time. But the question you ask is a legitimate one, and we're working on that, effective on Monday when the federal programs became live.
Okay, last segment, and this one is Adrian Dix and Dr. Bonnie Henry, and talking about making sure that healthcare workers are going to the same facility all the time, especially for caring long-term care facilities, and also we're going to hear about personal protective equipment and how it has to meet a spec before it can be distributed and deployed to our frontline healthcare workers. It is really important that this equipment meets a spec, according to Adrian Dix, and that we ensure that our frontline healthcare workers actually get this sort of equipment first, and we don't go out scared and out of paranoia and go buy things that really need to be in the hands of healthcare workers. Okay, so let's listen to Adrian Dix.
Good afternoon. I'm Adrian Dix, BC Minister of Health. To my right is Dr. Bonnie Henry, our Provincial Health Officer. Just to let you know, tomorrow there won't be any briefing, although we will be preparing and releasing a statement at around 3 o'clock with information about what's happened from Thursday to Friday. Dr. Bonnie Henry will be briefing here at noon on Saturday, and then after that we'll be back to Monday at 1:30. And with that, I'd like to introduce Dr. Henry.
Thank you very much, and I will start by acknowledging that we are on the traditional territories of the Lekwungen-speaking people, the Songhees and Esquimalt First Nations, and we're very grateful for the keepers of this land. For our COVID-19 case update today, we have 34 new test positive cases here in British Columbia, bringing our total to 1,370. That includes 626 people in Vancouver Coastal Health, 508 in Fraser Health Authority, 82 on Vancouver Island Health Authority, 130 in Interior Health, and 24 in the Northern Health Authority. Right now, in terms of our case status, we have 132 people who are in hospital around the province, and of those, 68 are in critical care or ICU. We have, unfortunately, 2 more people who have succumbed to COVID-19, bringing the total number of people who have died to 50 in British Columbia, and that is 1 person in Vancouver Coastal and 1 in Fraser Health in the past 24 hours. 858 people have fully recovered from COVID-19. I did want to talk for a few minutes about long-term care. We have no new facility outbreaks, and indeed we have an additional long-term care facility where the outbreak has been declared over. That's really good news. The 20 remaining facilities, however, continue to have active cases, and we have 235 in total cases that are associated with long-term care and assisted living, including 143 residents and 92 staff. And as you know, the vast majority of the people who have died are seniors and residents of long-term care. We recognize that residents of long-term care really and assisted living are very vulnerable to COVID-19, and the most important area that we do and what we are trying to do is make sure that the workers who provide the care and the service to people in long-term care are able to work at a single facility. This is something that we have recognized in public health from the very beginning of this outbreak, and indeed recognized it from outbreaks that we have every year, whether it's influenza or gastrointestinal outbreaks or even antimicrobial resistance outbreaks. The challenge that we have with care providers needing, and healthcare workers of all kinds needing to work at multiple different facilities makes it such a challenge to try and control outbreaks, and that has been brought to the forefront during this pandemic. in many ways, and it is a part of the tragedy that we're dealing with the multiple long-term care facility outbreaks. And we have mentioned before, but as of today it's official, we have been using orders under both the Public Health Act that I've given and under the Emergency Programs Act to implement a process to make it possible for care workers, healthcare workers of all kinds to work at a single site only, and to be able to do that in a way that's effective and able to give support to staff who are continuing to respond courageously to the monumental challenges that we're facing, and to do their very best and the very best we can do to protect our elders and seniors in long-term care and assisted living. And they have our tremendous respect and support during this pandemic. This is, as we have said all along, we are taking a cross-government, all province, and every single one of us in this province are responding to try and stop COVID-19 from affecting our communities and our families. And this involves ensuring our healthcare system is robust and ready, and we've done many things around that. This is another step in long-term care that we know will make a difference. Taking care of our frontline healthcare workers so they can care for us is another important piece. Protecting and providing support to our most vulnerable, whether it's people with disabilities, people who are living on the streets, people who are in long-term care, our older citizens, our seniors and elders, people in remote communities and in other facilities. Doing all we can as individuals across this province to keep our firewall strong. And I do want to recognize that so many people across BC are doing their part, and it is making a difference. The single site order that we just talked about makes our health system stronger and is, in my mind, vital to preventing further transmission and protecting our elders and seniors. I also want to recognize the early childhood educators, the K-12 teachers, and the educational assistants who have really stepped up around the province and are in classrooms and daycares to support our healthcare workers and other essential workers, but particularly to support our healthcare workers and our most vulnerable children, the children who are most at risk of falling behind because of this pandemic. So thank you to them. Those kids would otherwise face setbacks that they may have difficult challenges for the rest of their lives, and the work that you're doing is incredibly important, so thank you for that. As I've been saying all week, we are not over the hump yet, and we are going to have a bumpy ride for a while. We're holding our own, and we're keeping it down, but we all need to continue to do this. And when we go into this long weekend, it's more important than ever that we keep going, that everything we are doing now, we keep up. And I know this is a challenging time for many of us, both physically, emotionally, mentally, and it's hard, especially when those connections that we so need, those meaningful connections, are mostly virtual connections. And that is something that many of us have a hard time getting used to. There are many resources that we're making available more and more to you, and as announced today by Minister Judy Darcy, more is on the way. If you are struggling and you need extra help, please reach out. We talked earlier this week about there's a number of websites. You can reach out to your primary care physicians. You can go to Anxiety Canada, Bounce Back BC, and there is more resources that were announced just this morning by Minister Darcy. So this is a long weekend for many. It's a weekend as well when there's many religious and faith-based things going on. And what I really want to say is, let's make this a weekend to unwind, but to be kind. It's a weekend for us to stay at home and to appreciate what we have. Now is not the time for travel unless it's absolutely necessary and you need to take care of your family. There's lots that we can do close to home, with our family, with the people we live with our close circle of friends. Have fun, but be safe. Reach out to your elderly neighbor. Offer to tidy their garden. Drop off food. Host your own cooking show online. Stream a movie with a friend. There are so many things that we are starting to do now to stay connected. We can have a virtual block party at 7 o'clock. I know in my neighborhood we do that. Sit in the sun and read a book. It's supposed to be nice this weekend. Let's stay close. It's also okay to go for a bike ride or go for a walk in the sun, but keep your distance. Let's wave hello to our friends and neighbors. Wave hello to those that we pass, but from a safe distance. We all need kindness, and we all need connection. So let's do that safely and do that at home this weekend, and to continue the mantra to be kind and to be calm and to be safe.
Thank you very much, Dr. Henry, and I wanted to, first of all, as well, acknowledge the territory of the Sanghees and the Esquimalt First Nation of the Lekwungen-speaking people, and to say that this is, as every day when we announce, and Dr. Henry announces an increase in the number of people who have passed away from COVID-19. That number is now 50 in British Columbia, 2 cases today. We wanted to pass on, and I wanted to pass on my condolences as well to the families and the friends of the people involved. This is a very difficult time to express grief. In some ways, the limitations on our ability to come together is most painfully felt by those who are feeling grief, and must be especially painful for all those who have lost loved ones to COVID-19. So I wanted to express just my deep sympathy and condolences with all of those people. There are 1,370 cases, as Dr. Henry said, positive tests of COVID-19 in BC. That's up 34. 858 have recovered, which is a tribute, I think, to the fact that people can get well, but they need to do what they need to do and get well and recover from COVID-19. I think, as I've continued to say, there's now 132 people in hospital. That's 62 in Fraser Health. That's 10 in Interior Health, 12 in Vancouver Island Health, 5 in Northern Health, and 43 in Vancouver Coastal Health. And just to note in that context, so 132, which is a reduction in overall hospitalizations. There's an increase in those who are being treated in ICU. There's 4,493 empty beds in the system. And that means our occupancy rate is 58.7% today, and it's even lower, it's below 50% again in critical care units. So that is a significant and ongoing issue. Yesterday we had 3,181 visits to emergency rooms. That's down from March 9th, which would be a typical day of 6,559. And we had 300 fewer ambulance call-outs yesterday than a typical day in BC. And what we're seeing is somewhat of a reduction in influenza-related calls because of a decline in influenza, although not COVID-19. I want to talk a little bit about some of the implications of the order with respect to long-term care. As you know, as Dr. Henry has said today, there are a lot of cases in long-term care. It represents a significant portion of the number of cases, and of course a majority of 30 of the 50 deaths in BC from COVID-19 have happened in long-term care. I think residents of long-term care and assisted living homes are obviously very vulnerable, and it is a huge preoccupation of all of the work of public health on this issue. And one of the most important things we can do is to protect them and those caring for them, is to make it possible for workers to provide services at a single location. In response to the Public Health Officer's order, and with the support of the Emergency Programs Act, we've developed a single-site transition framework with employers and unions that involves all workers at health authority, nonprofit, and private facilities. And it ensures that all of them receive an equitable wage and scheduling stability so they can work at a single site without financial hardship or patient service disruption. In addition, employee preferences will be accommodated wherever possible in this process. Over the coming days, the Ministry of Health will be working collaboratively and inclusively with the health authorities, HEA-BC, unions, the BC care providers, denominational health, and private employers. This will include a provincial reference group that will be established by the Ministry of Health provide recommendations and guidance on systemic issues that are identified. Implementation, of course, will be done at a regional level and is well advanced here in Island Health and Vancouver Coastal Health and working ahead in Fraser Health within the existing blended service delivery model of Health Authority owned and operated, affiliates, and private providers. Let me be clear. This does not alter the existing framework of how long-term care and assisted living services are provided. With respect to the financial implications of making this change, government is working on understanding the costs associated with the provincial health officer's direction. But we anticipate that it will be in the neighborhood of $10 million a month. Long-term care and assisted living staff are responding courageously. And Dr. Henry has said this, courageously to the monumental challenges during this unprecedented time. They deserve our respect, our celebration, and our support. I want to acknowledge all involved, the HEU, the BCNU, the BCGU, the BC Care providers, and many more, all of whom have advocated and have supported this change and have worked collaboratively in this direction. This involves thousands of workers, but those workers deserve everything and all our support to do the work that they need to do to ensure that residents are cared for in long-term care and assisted living, and that they're cared for in as much safety as possible. I want to speak briefly about personal protective equipment. We're getting PPE from a variety of new vendors and suppliers, in particular in China. Importantly, we're taking our time to inspect and test any and all PPE that comes into BC before it gets near the healthcare system. This is a normal and expected process. So I'm going to give you some of the recent examples, success of sourcing PPE. This is from the last week. We've received many donations, 100,000 surgical masks, 83,000 N95 masks, 10,000 goggles, 20,000 gloves, 1,760 protective coveralls. We've purchased 800,000 surgical masks, in addition to the ones we've spoken of before, 157,000 isolation gowns, 85,000 pairs of gloves, and 54,000 N95 masks. And from the federal government, we've received 900,000 surgical masks and 36,000 N95 masks. So we're making incremental progress, but what we need to do and what we are trying to do is buy in the hundreds of thousands. Sometimes it's been suggested that you can buy masks online or people can access them online. Those masks almost certainly do not meet the standards required, and we have to assess and ensure that all PPE is provided to employees. It provides appropriate protections for those employees. That is critical for us, and employees can have confidence in the equipment they're being provided, and we have seen in other jurisdictions what can happen when that's not the case. I wanted to say finally that we're optimistic about the new rules that are going to take place at the border starting tomorrow, and that this is an important period. This weekend's an important time. As we've said, and as Dr. Henry said, this is not the time for non-essential travel. Today I released a joint letter with Tyler Shandro, the Alberta Minister of Health, where we said let's not visit each other's provinces this weekend. Albertans going to second homes or cottages in BC doesn't make sense right now and shouldn't happen. British Columbians visiting Alberta equally should not happen. This is not the time for that. This is the time to be as virtually as possible, but to be with the ones in our own homes that we care for, that we live with, that we're around. It's a time for that. It's a time to recognize religious holidays, if that's what you do. It's time to celebrate spring, if that's not what you do. If you're not following the many religious holidays that are occurring in these periods of weeks, but it's absolutely the time now to dig in, to be 100% all in, to do everything we can to bend the curve without breaking the rules. And that's what we need to do now. And I think this is an important weekend for all of us. And whether you want to go to Sechelt for a trip, this is not the time. If you want to go to a fishing cabin, this is not the time. This is the time to be 100% all in for one another, for the ones that we love and for the ones that we don't know.
Thank you for listening today. Have a very happy Easter, Passover, Ramadan, or Vaisali, and we will talk to you next week. Thank you very much, and be safe, and follow the social distancing orders, and just enjoy your families at home. This show has been produced by Depictions Media. Please contact us at depictions.media for more information.